Today we're going to talk about make no mistakes when it comes to Medicare. Medicare is a topic that can create many mistakes, and our goal is to help people prevent those mistakes. We're going to begin by looking back in history to the year 1769. At that time, Benjamin Franklin said something that would live on forever. In this world, nothing can be said to be certain except death and taxes. And today in 2014, we can add one more certainty, and that would be Medicare mistakes. If we think back to the start of Medicare in 1965, life was simple for people who were in Medicare. They would turn 65, they would retire, they would sign up for Social Security, and along with that came their Medicare card, the little red, white, and blue card that enabled them to see doctors and get hospital care, and life was wonderful. Then we take a look at what is happening right now. This is a chart of boomers. All of the red bars are those boomers out there. Between now and the year 2030, there will be at least 10,000 people turning 65 every day. When you think of the fact that that's going to continue on for the next 16 years, Medicare numbers will grow by 36%. And then not only are the Medicare numbers increasing, but we have to look at some of the other challenges people face as they approach the age of 65. It seems about 3, 4, 5, 6 months before your birthday, you start getting more mail. And this is the type of mail that you will get. It talks about the ABCDs of Medicare and the zero premium plans and the Medicare supplements and Plan F and Plan N and supplement insurance. And before you know it, you're wondering, what is all of this and how does it fit together? And that's where we tend to see Medicare mistakes come into play. The causes of Medicare mistakes, of course, the confusion, because there are so many different pieces and it's difficult to understand how they fit together. Then we have deceptive, misleading, or false notions out there. People spin information in a different way, and it gets interpreted and passed on in a different way, and everybody's situation is unique, and so we tend to get more messed up. The end results then, greater costs. If you don't know what you're doing, you can end up paying more than you have to pay. Penalties, if you don't act in a timely fashion, you're going to get hit with penalties. And something that you may not even realize until 10 or 15 years down the road, the decisions that you made end up resulting in inappropriate coverage for you. We're going to look today then at 5 mistakes that are very common and can have big repercussions. And the first one has to do with the number of parts in Medicare. Anybody that I ask will say there are 4 parts in Medicare. However, as I got working with consumers and beginning to teach Medicare, I realized that this is a core of confusion, the 4 parts. What we believe there really are is only 3 parts that go together into 2 paths. And so let me take just a couple of seconds to explain this. The first part of Medicare is hospital insurance. This is Part A. It is a part of Medicare that will cover inpatient care in hospitals and skilled nursing facilities, along with the home health care benefit and hospice care. The second part of Medicare is medical insurance, which you can think of as the outpatient component. It covers medically necessary services that will diagnose and treat a medical condition. It also will cover quite a few preventive services. Medicare has expanded the benefits in that area considerably. Then we look at prescription drug coverage. This is the new part of Medicare that's been around since 2006. Prescription drug coverage helps cover prescription meds. Helps cover means that the plan will not pay all of the cost of medications. Prescription medications, no over-the-counter drugs. So if you can get a medication by walking into the drugstore and your doctor doesn't even know you're getting it, the Part D plan will not cover that. And then formulary. Formulary being a list of the medications a plan covers. No plan has an identical formulary to any other plan, and that becomes important as we look at some of the other issues in Medicare. Each plan determines the medications it will cover and the premiums and co-payments. Medicare has set some minimum standards, but then each plan is free to determine which drugs it will cover and how much it's going to charge for those medications. We have seen in our clients the medication metformin, a type 2 diabetic medication. Co-payments in drug plans have ranged from $15 all the way up to $105. So that's a startling example of the differences between plans, and that's why it's important to know about your plan. So those are the three parts, A, B, and D. Now we'll look at the two paths of Medicare. To the left is original Medicare, to the right is Medicare Advantage. And let's look at the original. This is standardized coverage, meaning the way that it is set up, the co-payments that you will incur are standardized throughout the country. So if you were hospitalized in Wisconsin, you would pay the same amount as if you were to be hospitalized in Texas. You can see under Original Medicare any provider, doctor, clinic, therapist who accepts Medicare assignment. Assignment means that the person, the provider, has accepted Medicare's payment and contractual obligations so that you will pay whatever that Medicare says that you will pay, and the provider won't charge you anything beyond what Medicare allows. This starts with Part A and Part B, and then if you want comprehensive coverage, you would add in a Part D prescription drug plan to cover medications and a Medigap policy. A Medigap policy is also known as Medicare Supplement Insurance. This is Medicare coverage administered by private insurance companies, and its purpose is to cover the gaps in Part A and Part B, gaps being the costs that these two parts of Medicare do not cover, hence the name Medigap, gaps in Medicare. The important thing to know is that Medigap policies are part of Original Medicare, and they do not work with Medicare Advantage plans. Medicare Advantage, then, is the other path that people can choose when they are turning 65 or going on Medicare. We can look at this as managed Medicare. It is Medicare that's administered by a private insurance company. The insurance company is in charge of this type of Medicare delivery, and hence it is a replacement policy. It may be called or known as Part C, but in reality, it really replaces Original Medicare. So it provides Part A, Part B, and Part D services in place of Original Medicare. So it does the Part A and Part B, and many plans provide D. That is known as an MAPD plan, Medicare Advantage plan with prescription drugs included in it. The first mistake then was thinking there are four parts in Medicare when there are really only three. The second mistake has to do with the path that you choose, believing that you can switch paths in the future when your health or circumstances change. Changing Medicare coverage is an important topic. When you are approaching Medicare and you come to that fork in the road, too many people will follow Yogi Berra's guidance and take the fork without even realizing what they are doing. Now, when it comes to changing Medicare coverage, you can switch from Original Medicare to Medicare Advantage any year during open enrollment. So when you turn 65, you opted for Original Medicare with a Medicare supplement, but 4 years down the road, you say, well, I want to go to Medicare Advantage, and you can do that from October 15th through December 7th. Also, any year during that same time, you can disenroll from, which means you can drop your Medicare Advantage plan and then return to Original Medicare, Parts A and Part B, and get a prescription drug plan. However, there is no guaranteed issue right for a Medigap policy. So you are allowed to go back and get Part A, Part B, and Part D, but you don't have a guaranteed issue right. And exactly what that means. A Medigap guaranteed issue right tells us that an insurance company cannot look at your pre-existing medical conditions when deciding to give you a policy. The insurance company cannot deny or delay coverage or raise premiums because you might have diabetes or arthritis or some other medical issue. There are 3 times that a Medicare beneficiary has this guaranteed issue right. The first time is when that beneficiary is initially eligible for Medicare and goes on Part B at age 65. The second time applies to those people who did not sign up for Medicare at age 65 because they had coverage through their employer. So they decide to retire at age 68, and that's when they enroll in Part B and go on Medicare. So that's when their guaranteed issue right begins. And there is one other time, and that is during a Medicare Advantage trial period. The first time that you take a Medicare Advantage plan, you have this guaranteed issue right during the 12 months. So you get to try a Medicare Advantage plan and see whether it will work. And if in the 10th month you say, this isn't going to work for me, you have a guaranteed issue right to go back to a Medigap plan, known as Medicare Supplement Insurance. Now, a few states have more liberal policies, which means that they may give you a guaranteed issue right every year around your birth date, or there are a couple states that will give you a guaranteed issue right every day. So those people can make the switch anytime. But the rest of us in approximately 47 states have to ask the insurance company, if we've been in a Advantage plan for more than 12 months, we have to ask the insurance company, can I get a policy? The insurance company may say yes, or the insurance company may say, no, you have diabetes and we're not going to insure you. Or you have arthritis and we're going to delay your coverage, or we're going to raise your premium. So guaranteed issue right means they can't ask about your health. After that period has passed, then it's up to the insurance company, a very important point. So original Medicare, you want to give that up. Any year during open enrollment, you can just go to Medicare Advantage. But if you're on Medicare Advantage and you want to go back to original and get a supplement, you might find out that the bridge is closed and you're not able to get your supplement. Mistake number 3, not realizing that the 2 paths of Medicare handle costs differently. Under original Medicare, you pay the Part B premium, which this year is $104.90. That's the basic premium. You also then would pay the standard Part A and Part B deductibles, co-payment, and co-insurance that the government sets every year. And this is the 2014 version of those costs. For example, hospitalization, $1,216 deductible. I would pay that here in Wisconsin if I went to the hospital, or I would pay that out in California if I went to the hospital. Then you have your Part B deductibles and co-insurance. $147 deductible under Part B, the same no matter where you might live. The 20% co-insurance when you go see the doctor. Medicare covers 80%. You would be responsible for the 20%. Those are standard costs. Medigap policies, Medicare supplement insurance premiums range from around $100 to up to $250, maybe more, depending where you live, depending if you're a man or a woman, whether or not you smoke. And many offer first dollar coverage, which means you go to the doctor's office, the 80% Medicare pays, the Medigap policy would pay the 20%, so you never have to get the first dollar out of your pocket. Standalone Part D drug plans, the monthly premium in 2014 starts at $12.60, and then they can go upwards all the way to $200. The more complicated your medication regimen, the more likely you will pay a higher premium for your drug plan. Medicare Advantage costs then. These plans handle costs differently. Everybody has to pay the Part B premium, $104.90, basic. And then you will find that these plans offer reduced premiums. About 80 to 90% of the country, there is access to at least one zero premium plan. So you get your drug coverage and your medical coverage for zero premium in this plan. Out-of-pocket costs depend then upon how the plan is going to handle them. In most plans, you will see co-payments or co-insurance for services, and I put a very common example in the handout. $250 a day for the first 5 days of a hospital stay. So when you go into the hospital, this is the co-payment that you are going to look at. This is not standardized. The costs are very specific to the network which applies to the area in which you live. For most Medicare Advantage plans, if you go out of network for hospitalization or doctor's visits, you will likely not have coverage. You will be responsible for all of the costs. There is no supplement plan to cover these costs. So you might be paying zero premium, but then you're looking at $250 a day if you end up in the hospital. Now, Medicare Advantage plans have out-of-pocket limits for medical care. The national maximum is $6,700. So if your plan has a $6,700 maximum limit, when you hit that amount, you would not pay a penny more for covered services through the remainder of the calendar year. Some plans will voluntarily offer a lower limit. So instead of $6,700, you might see $4,500. That would be your out-of-pocket plan limit. Mistake number 4, not paying attention to Medicare at age 65. We have seen people who believe you are enrolled in Medicare automatically. Or we have seen people who believe if they are already on Social Security at 62, they can also get Medicare at 62. Or if you delay Social Security until age 66 or 68, you can also delay Medicare enrollment. Fact is, you have to pay attention to Medicare at age 65. Now, whether or not you enroll depends upon your circumstances. Only those people covered by an employer group plan sponsored by a large employer can choose to delay Medicare. A large employer for Medicare purposes is 20 or more employees. So if you are working for a company with 50 employees and you're happy with your employer coverage, you do not have to enroll in Medicare. The plan cannot kick you off of it. The plan cannot raise your premiums. If you are not the one working, but your spouse is working for a large company, you can stay on that employer's plan because they cannot change the rules for people 65 and over. Let's say you're approaching your 65th birthday and you are already taking Social Security benefits. Medicare will enroll you automatically in the program, so you don't have to do anything. You will get your Medicare card in the mail before your 65th birthday. Everyone else must pay attention to Medicare during the initial enrollment period. So if you have retiree coverage, or if you are a veteran, or if you are on COBRA, you have to pay attention. Now, the initial enrollment period is the time frame in which you can enroll in Medicare and not face any penalties. It is a 7-month period that begins 3 months before your birthday, the month of your birthday, and ends 3 months after the month of your birthday. Now, if you want to of a calendar, you can go to this address on our website. You put in your birth date, April 12, 1949, and you will see an individualized enrollment calendar. The birthday month is in the middle, April. If you enroll in the 3 months before your birthday, your coverage will begin the first of your birthday month. If you enroll in your birth month or after, your coverage will be delayed a couple of months or so, but you will not face a penalty. So when you are approaching your 65th birthday, be sure that you pay attention because you don't want to incur penalties. And that's where we get into this penalty phase if you don't pay attention. If you delay enrollment in Part B for 12 full months, you will be looking at a monthly penalty. This amount will be added to your Part B premium. This year, the premium is $10.49 every month. That is 10% of the standard Part B premium. If you're 2 years late enrolling in Medicare, the $10.49 would double and you'd be looking at $20.98 every month. You also would incur a penalty. Excuse me. You would also incur a penalty for the Part D prescription drug coverage. This is 1% of the standard Part D premium added to what you pay every month. This year, that penalty amount is 32 cents for every month you are delayed. So if you were 10 months late in enrolling in Part D, you'd be looking at about a $3.20 penalty added to your premium every month. This penalty will follow you for the rest of your Medicare life, and the amounts change every year depending upon what the government sets as the standard premiums. It looks as though Part B next year may be the same amount it is this year, so that penalty for Part B would not change. The Part D prescription drug coverage standard premium will be going up, so I suspect that penalty will be about 34 or 35 cents a month next year. But we'll have to wait to see what the government does. And mistake number 5. This conference is very timely with regard to mistake number 5. Failing to check out what's happening to your plans next year. In about 2.5 weeks, we're going to begin open enrollment, October 15th through December 7th. This is also known as the election period, and it happens every year during the same time period. This is important because Medicare Advantage plans and prescription drug plans can change many factors going into next year's coverage. So you are very happy with your plan this year. However, be aware that the plan can change networks, which means that your doctors may no longer be in the Medicare Advantage plan. The drug plan can change the premium, or the Medicare Advantage plan. Your premium might have been $0 this year, but next year it might be $39. They can change deductibles, co-payment, co-insurance, and out-of-pocket limits. So you could be looking at increasing costs from this year to next year. What you need to do during the open enrollment period, in a week or so thereabouts, the plans will be sending out information. You will be getting a notice of changes in your coverage for next year, and in that will be a summary of the changes. Like the out-of-pocket limit is going to go from $4,400 to $4,900. Or they will include the changes in the drug formulary. You need to look at that to see whether you can live with those changes next year. Look for your medications to see if they're going to change the tier or the cost. Decide then whether you want to keep the plan or if you want to pick a new one. Studies have shown that people who do not pay attention will end up overpaying by several $100s, and you just don't want to leave that money on the table. So you're getting ready to travel the road to Medicare. What are you going to do? Which way will you go? Nobody can really tell you or make this decision for you. So it's important for you to learn about Medicare and all of the options. If you are in a state that has the guaranteed issue rights we discussed, it's very important for you to think about your health, your lifestyle, where might you be not only tomorrow, but 10 or 15 years down the road as you think about the options in Medicare. You may not be able to change paths if your health or your financial situation changes. Don't rely on agents or friends to make this decision for you. When we have done consultations, we often have the husband and wife picking different drug plans or picking different Medicare Advantage plans because of doctors or drugs or just whatever the issues may be. Go beyond the premiums to the cost for the services that you will or may use. Very important, because the premium may be very enticing, but then you start to look at, well, I'm going to need this service, and these medications, and then you can see how your costs might rack up. Consider how important it is to keep your physicians and your providers. You may have been reading the papers about one of the large Medicare Advantage companies dropping 15,000 to 20,000 providers from their networks over the next few years. They do that because they're trying to control costs, or they're trying to improve their quality ratings, or for different reasons. So if it happens to be your doctors that are in that number to be dropped, you have to figure, well, do I go with a new doctor in the same plan, or do I look for a plan that has my doctor? Medicare, very easy to make mistakes. The 5 we talked about today are some of the most common and some of the most costly. By taking these few minutes today, you have taken a big step on the road to preventing those mistakes in your life, and that will benefit you in the long run. So I'm going to turn the program back over to Melinda for any wrap-up, and I have enjoyed the time to talk with you today.
Thank you so much, everybody, and we look forward to talking to you again soon. Bye-bye.